I'm Janelle Marie. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking all about plastic surgery, different topics. Of course, anything we say today, consult your physician first. But let's talk about liposuction.
Okay,
always very popular, right?
Yep. Still one of the most popular procedures we got.
And is there now a new way of doing liposuction than in the old days? Has it gotten better? How is it done now?
There's a lot of new ways, but I'm not sure it actually got better.
Oh.
There's just a lot of different ways to do it.
Okay,
now.
okay.
I think the last big progress was changing to tumescent solutions, so putting fluid in before doing the liposuction. And all of these new methods require that. So it's hard to separate one from the other.
What does that do, putting the fluids in?
Well, it does a lot of things. One is there's a little epinephrine in there which causes the blood vessels to shrink.
Oh,
so you
okay.
get less bruising and less
that's
bleeding.
good.
And less bruising usually means feels better afterwards, too.
Exactly.
Because we're putting a lot of fluid in there, we're compressing even the little veins that don't respond to epinephrine. So again, less bruising from that, too.
Okay.
And
less
there's
pain.
a little lidocaine in there which helps afterwards with the pain control. So it works very well. It makes it easier to see what I'm doing, too.
Yeah.
Because as I'm doing liposuction, what's coming out looks like clean yellow fat.
That's wonderful.
Whereas without the tumescent fluid, it looks very bloody.
Oh, no.
And you couldn't remove as many cc's or as much volume because at 1.5 liters without tumescent solution, you have to start thinking about transfusing someone.
Oh, there was just too much blood coming
Now we can do
out.
5 liters very safely.
That's good.
Yeah,
so who's a good candidate for liposuction?
So liposuction, best candidates have tight skin, good skin, but areas that are just disproportionate.
Oh,
so if I have someone who's very thin, like in their torso, but has that large butt or large hips that they want to bring that in, or large thighs because all the fat goes there.
Yes.
In order for them to lose weight and have their thighs look the way they want, they look like they're starving.
Gaunt in it, yeah.
So what we can do instead is say, okay, I want the fat to leave from here with liposuction. So we can pick the spot where we want it to leave from. So areas that are disproportionate, where the skin is not already loose, works very well.
You just can't get rid of in the gym. Because they say spot reducing, you can spot reduce. Probably not.
It's more genetic. We're kind of programmed. Our cells are like, they have like little numbers on them. Now serving number 1, number 2. So wherever it wants to go first, it goes there first. And that's usually the last place it'll leave from, too.
So pretty much it's not in our control.
Yeah, well, there are things we can do. If someone's 100 pounds overweight, liposuction not going to be helpful.
Not a good candidate.
And the most we remove is 10 or 11 pounds. They're still 90 pounds overweight, which I don't think I've helped in that case.
Because a lot of people do think they can just go in and get a lot of fat sucked out, but that's not the case. What about men and women? Do men come in for a lot of liposuction? It's something that men are doing now more, right?
Yeah, mostly the abdomen, the love handle areas. And even if they're in good shape, we can see a little better definition of what's going on sometimes by getting rid of that last little extra fat that's there. And the chest, too. So if someone has a little gynecomastia that's mostly fatty, liposuction works very, very well. And even the folks who have a combination of fat and gland, I will often do liposuction first or afterwards just to help smooth things out farther than I can reach with the little incision at the nipple.
Fantastic. Let's take a look at some pictures. First one. Oh, well, there it is. Speaking of.
So here's someone that had a little bit of extra fullness and wasn't happy with the way that his chest poked out and accordingly his nipple, even under shirts. So if he's wearing like a tight knit shirt, you know, unless it's got a good pattern, you're going to notice something going on.
Some man boobs going on.
So what I've done is just liposuction and remove that.
It looks great.
And when there's still a little extra glandular tissue in there, then I make a little smiley face incision from like 4 to 8 o'clock under the areola and can pluck out that firm stuff that won't come out with the
So there's not a lot of scarring?
No, very little scarring.
And really with liposuction, is there a lot of scarring?
Up in the axilla.
Oh.
So it's about 1/4 inch.
Oh, so it's not a big deal.
Hidden,
Liposuction period, though, is there not a lot of scarring?
No, that's the advantage.
Okay,
that's good. We're not having to remove skin, so we don't have to make an incision.
Don't have to make the big incision.
But sometimes the skin is in good tone. So she has good tone in the lower abdomen, and what I've done is just suck out that last bit of fat, so it looks a lot smoother.
That looks great.
And you know, if some people who have that, if the skin is very loose, then you know, a mini tummy tuck would be a better choice. But in this case, this tone is very good.
Mini tummy tuck, is that only the skin, or do you do the muscles with the mini tummy tuck?
I can do the muscle below the belly button.
Oh, okay. So it's not as invasive as the...
It's not, but it also doesn't do as much, so you have to be the right candidate for a mini, too. It's not like we can choose one or the other.
Right.
They have different indications.
You have to be the person.
And here, too, just sort of disproportionate fat at the lower abdomen. That looks great. And then afterward, just nice and flat.
That looks really good there.
Yeah, it works well.
Yeah, she just needed that little tiny bit, huh?
Just that little bit. And it was bugging her in tight, like a tight skirt or dress.
Final picture here.
So same thing here. This one I did do a tummy tuck.
It looks that way,
I've done some liposuction, and again, I've moved some of that fat down. So I took some of the fat on the upper part of the buttocks, moved it down to round things out.
That's fantastic.
That helps. So, you know, now her clothes fit much better. And that extra skin, if I had just done liposuction in the front, that extra skin would still be there, would still be folding over.
You had to do the tummy tuck on that.
Yeah, so that's what makes a difference.
Sounds good. All right, we're going to wrap up this segment. For more information about Dr. Mealy, you can call, if you need that tummy tuck or liposuction, call him at 925-943-6353, or you can check him out on the web, drmealy.com or sanfranciscobreast.com. We got lots more coming up. Stay tuned to Body Beautiful.